Corporate dental practices pose a severe challenge for many private practice dentists. With their economies of scale, a corporate practice can undercut private dental practices on price and generally offer greater availability. Now, there's a growing trend towards one type of specialty corporate practice that could pose the same challenge for specialist and implant-driven practices. After the break, I want to tell you how general dental practices and specialty practices can meet in the middle and beat down corporate dentistry. Stay tuned. I'm Colin Receiver, CEO of SmartBox, and thanks for watching the Patient Attraction Podcast. Now, if you offer dental implants in your practice, let me ask you a question. Do you think you could compete on price against a specialty corporate implant center? Now, if you answered yes, how long do you think you could wage that price war against them? Unless you have incredibly deep pockets, the answer is not long. If you look at the pricing structure that the Clear Choice outlets offer, it is generally already lower than a lot of private dentists charge. You might think that you won't have to worry about specialized corporate dental practices in your market. You're wrong. Take Clear Choice again, for example. They have 32 offices and 70 clinicians nationwide. They advertise they've done more than 40,000 cases. They offer some version of teeth in one day at a fixed price to their patients. And the writing is on the wall for dentists who are willing to read it. Corporate dentistry is coming after the individual big-ticket revenue streams that many private practices rely on. And with corporate dentistry's economies of scale, private practice dentists are going to struggle to maintain their cash flow in those markets. And that's a hit that not every private practice is going to be able to withstand. Now, if you want to ensure that you can withstand the corporate storm and not become another casualty, act now. It's possible to segment dental patients into two broad groups. Those who are price-driven, and then those who simply are not. The price-driven patient is corporate dentistry's prime target. Their advertising primarily focus on price and convenience of appointments. And in the case of dental implants, that probably would appeal to 80% of the market. That leaves the other 20% of those prospects who should be your prime targets. Corporate dentistry has one major liability by its very nature that it cannot overcome. It can't and doesn't engender patient trust. If that corporate dental implant patient has a problem, he or she isn't guaranteed to see the same doctor. And most likely, the appointment will be with the first available clinician. The 20% of implant patients who are not motivated by price are strongly motivated by trust and relationship. That patient segment has the resources and the willingness to pay more for the right dentist, one they can relate to, one they trust, one they regard as the expert. Now, for most dentists, attracting those better patients will require a shift in their marketing focus. Price-driven advertising simply doesn't work. You need to give those 20% of prospects reason to choose you instead of a competitor to solve their dental problems. Now, you won't accomplish that through postcard campaigns or newspaper ads, but you can position yourself as the trusted dental expert using our industry-leading patient attraction system. Now, not only can you get more patients, but also attract better patients that will position your practice to withstand competitive threats. If you want to find out what our patient attraction system can do for your practice, go to patientattractionblueprint.com. Schedule a call with us. You'll learn how you can double or even triple your practice. Or you can wait for corporate dentistry to siphon away all of your high-value cases. Join me for our next podcast. Until then, keep moving forward.